differently abled, differently.
Welcome back. Persons with non-communicable diseases had an opportunity to champion for patient safety during the Global Week for Action on NCDs. Take a look.
The Global Week for Action on NCDs was marked in Nairobi Arboretum.
World Patient Safety Day is one of WHO's public health days, and it's been ongoing since 2019. Its objectives are to increase patient public awareness engagement and enhance global understanding and work toward global solidarity and action by member states to enhance patient safety and reduce patient harm.
During the event, patient safety was discussed extensively, being paramount in healthcare.
World Patient Safety Day is just one day, but I'd want to encourage you to carry it on as a culture, like throughout the year, because we've seen you, me, all of us, your family members, your friends are all patients. They take medication, they might have adverse events. Because you're in the know, please take the appropriate action, but carry World Patient Safety Day's theme throughout the year, even in your daily activities.
We have to create awareness to the patients, to the public, and this is not something that can be done again by PPB or Afya House alone. So this is something that all of us have to do it. We have family WhatsApp groups. We have school WhatsApp groups. These are avenues where we can pass this information.
It is not about treating the condition, but also ensuring the well-being on patient in the journey of recovery or management.
Initially, when patients will go to the hospital, they will be given medication without even patient information leaflets. But then the world has really evolved. And nowadays, by the time a patient is coming to hospital, they've already done their research. And they're just kind of coming to confirm what they already know, if that's what you also know. With the engagement of stakeholders and patients being one of the key stakeholders, it became apparent that they have to be part and parcel of these pharmacovigilance activities that we are implementing. So you'll get sometimes patients walking in, someone has come from Kiambu, from Bungoma, coming to PPB to report that they bought a medication, they experience a reaction, or the syrup they've bought has a different smell. So we had to come up with ways of ensuring that we are engaging them.
It's one thing to train people, put them out there in the community pharmacies, but we have, I believe, 20,000 points where a patient can get medicines in this country. Yeah, I'm talking about public hospitals, Kunakama 5,000, and faith-based. Yeah, you have unregistered places where people get medicines. So as PSK, we are working with Pharmacy Employers Board to see how then do we rightly identify. Is there a pharmacist inside there or not? Or is there a farm tech there or not? Yeah, so that we move away from the premises to someone needs to take responsibility.
You learn somebody has done something wrong, even in training, because a number are in training. So even when you make a mistake in the facility you're training, say I have made a mistake, I have confused the patient, so that we can rectify that. We can call the patient and provide whatever remedy that needs to be there. So let's just learn from our mistakes and even learn from the incidences that happen.
One of the concerns is the rising case of non-communicable diseases such as diabetes, cancer, sickle cell, and heart disease. Universal health coverage ensures that everyone, regardless of their economic stature, can access quality healthcare and is key in improving patient safety.
How do we, as the public health dimension shifts to the community, how do you empower the community pharmacists and give them the right tools, as we've had, to be able to work with the patient and ensure that the right outcomes are gotten?
But patient safety is not just for healthcare providers. Self-prescription, though tempting, can be dangerous and is essential to consult a healthcare professional for accurate guidance.
When it comes to patient safety, I say this is a concerted effort. It's for everybody. It's not just about the pharmacist or the doctor. It's not about PPB being the regulator. It's not about the Ministry of Health ensuring that people are getting products, but it's everybody, the doctors, the nurses. So basically all the healthcare workers, all the policy makers, the patients themselves have to work hand in hand together to ensure that we have strategies in place that are working.
Patient safety is a shared responsibility among healthcare providers, policymakers, and individuals to ensure a safer and a healthier population.
Pharmacy is regulated, is a regulated practice. So currently there are several laws under review. We have what we call the KDA, Kenya Drug Authority Bill, that's soon to be renamed after the input we gave. The objective of that bill is to ensure that we first separate the practice from the product in a way that allows the product to be able to be given some focus, by itself, but also allow us to have a practice bill, so the pharmacy practice, levels of practice, and even move to that. The Constitution of Kenya, Article 43 says, patient deserves highest quality of care. 43(1)(a). Another one is called 46. It talks about the rights of consumers. They have to write the right to right information, right products, those R's that Dr. Iwak talked about. So soon, you'll be sued, if you're not already, if you are out there serving and the patient will feel disgruntled over something. I came, mtu wetu alikuja alikuwa na malaria na sasa ameenda. Was it the medication they got?
Statistics actually show that 50% of medication errors are actually preventable. So what policies and programs are we putting in place to elevate patient safety through engagement, through use of electronic and mobile platforms? And how do caregivers get involved in preventing medication errors? Safety and harm can be mitigated by end-to-end involvement of all players from the HCP, the institution, the outlet where they get medicines, the medicine education, and how the patients interact with the medicine. So one of the things we should be looking at, I think many of you probably will be working in a hospital setup, in whatever setup you are in, what is the easiest way, for example, patients can get in and out of a hospital or institution without causing additional harm to them? What kind of quality management systems or policies are in place to make sure that all the health system managers have proactively employed patient safety tools to assist the flow of feedback on basically how are their systems operating, and they are not adding to patient harm.
We really insisted that one of the people who should be in some of those boards is a patient representative. Yes, we agree as professionals, we're actually representative of the patients, there because we're the professional. But it's also good to have another eye there and even have the perspective of the patient.
Let's take a look at the UN Convention on the Rights of Persons with Disabilities.
Article 25 of the UN Convention on the Rights of Persons with Disabilities states that state parties shall provide those health services needed by persons with disabilities, specifically because of their disabilities, including early identification and intervention as appropriate, and services designed to minimize and prevent further disabilities, including among children and older persons.
And now, to our esteemed viewers, we as the Able Differently team came up with a very interesting segment that will run subsequent episodes to follow, and this segment is dubbed Disability Pet Peeves. And by so doing, we'll be in a better place to use better judgment in our actions or inactions to make persons with disabilities not to feel any less of human beings.
We're differently abled, differently.
We've come to the end of the show for today, but be sure to join us every other Saturday when time and space allows. My name is Jane Theory. See you next week.
We are here and we are strong. Let's be counted as we move on. Make a difference, change lives as we tell our different stories. We are capable, beautiful. We are born to do great things. We're unstoppable, incredible, 'cause we're differently abled, differently.